Hi, welcome to Health and Wellness Connects in our new podcast, Stress Free Aging. I'm Amanda Allen, and I have with me Michelle, and she is from Home MT House Call Services. So we are going to kick off this show. We've got some amazing topics to discuss, so we're going to get going here and see what we can accomplish in the next 20 minutes. So thank you for joining us, whether you're joining on YouTube or listening to the podcast. We're excited to have you as a part of our audience. So first, I'd like to just get right out there and understand that this last year, I turned 50. So
congratulations.
Thank you so much. I have less years in front of me than I have behind me is what I'm realizing. So this topic of stress-free aging has been very, very important to me because especially since the pandemic has come about. There's so many different things that are happening. One of the things I want to just bring a quick thing that happened. I had a friend of mine that contacted me and she said she had COVID. She was released from the hospital. One of our local metro hospitals. We won't mention names to protect them, but she went to leave the hospital, had COVID, was very sick, still very weak, and didn't have a walker, didn't have anything, wasn't able to even get to the restroom by herself. All of her family had COVID at the time, so they couldn't come over and help her.
No support.
So and her spouse was in another hospital. So this is a young woman in her mid 60s, I would say, mid 60s.
Very young.
Yes. And so she was faced with this. So it got me thinking about all the different challenges that are out there for our aging population. And that's something that has been brought up during this time of COVID is how many parents were not be able to see, children were not able to see their parents, or grandparents weren't able to see their grandkids. And during this time, and seeing how much it affected mental health, it affected so many incredibly different things that has happened during this time. So a little background, myself, what I do is I work in marketing. So I do twofold. I work with hospice as well as home health services. We've partnered together with your company, and I'm so excited to be serving your patients and providing amazing and excellent care.
Absolutely.
And the other part is I also work with senior placement. So I'm able to help place seniors into a senior living, independent living, an AFC home, or an assisted living, whatever it might work out. And we also do low income, which is something that's a little bit different for some people. There's not a lot of resources out there for that. So we cover Wayne, Oakland, and Macomb County, and we can place for those. But I just wanted to go in because go in and just talk about some of the challenges that we have. Again, when someone comes to the hospital and they get discharged, people don't realize that they have choices. They have a choice. When you walk in that door, your decisions are usually made by a case manager that's overwhelmed with many other cases that have, they have preferred providers that they like to use. But you, as a patient, you have the right to go in and choose who you want to choose. And that, I think, is really important.
And I think people do not understand that.
I don't think they do, because really a lot of times you're so overwhelmed. There's so many things being thrown at you, whether it's a new diagnosis, maybe it's something new going on in the, with your body, and there's, throw in COVID and some of the other aspects that are out there. It can be very, very difficult.
Well, and you're at the hospital's mercy too, so to speak.
You are.
You're just open, and they're doing all these things and saying all these things and what's going to happen later. You don't know anything.
And if you throw in someone that doesn't know anything about medical,
it's even worse.
It's even worse. And something that I wanted to, and I'm just going to touch on this very briefly, and then I'm going to turn it over to you, and we're going to just have some great conversations about what your company does and what they can offer for someone that might be shut in or something like that. One of the things that I have realized is that when you're navigating this health system, sometimes you're just at a loss. I had a case the other day. Lady called, said that her mother was actually in the hospital. Memory care issue. Didn't know what to do. Couldn't bring her home because nobody could care for her. So this is a new thing that's been thrown on them. They've been caring for mom all this time, and then all of a sudden, boom. She has to find a place to stay with 24-hour care because of a dementia issue.
And where do you start?
She started with a phone call. We walked her through. I went and toured places with her, talked to her. Mom was able to move in within 3 days of us meeting.
That's great.
Which was really good. And she qualified for the extra services because her dementia had deteriorated so greatly that she was able to qualify for hospice.
Even better.
And so there's so many other things that can happen with that.
Good resources.
So I want to ask Michelle. Michelle, can you tell me what Home MD House Call Services does and what kind of services that they offer to someone that might be shut in, or that maybe they don't want to go to the doctor anymore, or you can explain the process.
That's exactly where we come in. So what we do is we offer all the luxuries of a primary care office in the patient's home, whether they're at their own home, their children's home, the assisted living, the independent living, no matter where they're at, we offer care for them in their place of residence.
So even an AFC home that you can go into.
Anywhere that they'll allow us. So just like in the hospital, just like at home, before you get placed, before you're someplace else, you have choices. And there's always choices to make. So we do that. We bring in laboratory studies if we need to. We can do x-rays in the home. We can provide your services. We can provide home care services, physical therapy, all the amenities that we can do outside of the practice.
Okay.
We can bring into their home.
That's great. That is
so we
really
are
good.
that old-fashioned house call, stethoscope in a bag, bring everything right to your home.
So you have things like diabetic teaching, you have podiatry services.
We have podiatry NPs. We have a lot of our diabetics have Dexcoms so that we can real-time see their sugars 24 hours a day, 7 days a week. We have remote monitoring at home. So if they need blood pressure checks, if they need weight checks, if they have congestive heart failure, we're able to remote in and see where their trends are. We get phone calls, we get pings from our nurses that monitor these things and say, hey, Mr. Jones, blood pressure has been up for the last 2 or 3 days. I see that he's on this medication. They may suggest or make recommendations, or I text them back and say, I already have an appointment with him. Thank you for the information. And we go and have that conversation.
Okay, that's great. Let's go through the process. Let's say Aunt May slipped and fell. It's lots of slips and falls out here now in this weather. So let's say she slipped and fell and broke her hip. Okay, so she's in the hospital. Let's talk about what the process looks like.
So they look at discharge planning. The first thing when you enter in the hospital, first thing they look at is how long you're going to stay and where we're going to get you out to. So it all depends on your activity level, your independence, and then they start looking at placement, just like you talked about.
So the placement being such as a nursing home or rehab center, that's something that it comes up quite frequently that they have to go to a rehab center. But where do you go?
So the rehab center, they typically research and they go to the rehab center for 10 days or however long either their insurance will allow them or they get back to their optimal health. And then the decision from there is where can they go? Can they go back to their own home? And we can certainly go there and see them. Or do they go to an assisted living to where they can still need that extra help, but can't get back into the home
But
just
they can
yet.
still have a little bit of independence of their own.
100%.
Yeah. So something important that we just talked about as far as them going into a nursing home, a lot of times we talked about the case managers actually make those decisions, but it is a patient's choice.
And I feel that sometimes they get one or two, maybe, and not the whole gamut of choices.
Right. And sometimes many times it's a child that's actually going out there, and they're the ones making the decisions for mom or dad.
Absolutely.
So what this whole show is about is how can you age stress-free? How can you make those decisions? How can you educate before something happens?
And it's so hard. It is so hard because you can't predict, right? So I had a patient that just left the hospital. He had a case of shingles, and a very bad case of shingles. Went into the hospital 3 or 4 days, turned into 3 or 4 weeks.
Okay.
Then couldn't walk anymore. Has a walker, it got progressively worse. So the patient comes home, and the home care company called and said, these people can't get into a PCP office. He can't walk, the wife can't help them. There are all these dynamics going on that they've not had before. These are very well-educated people. The gentleman's a lawyer, and I don't remember what his wife does. But they're sitting at home as I walked in, they're just looking at me like, we don't know what to do. We've never,
Those
we
are the
have
questions I
never
get all the
had
time.
this predicament happen. Like, what do you do? How can we help? Can we also have a primary care and your services? Do we ask you for medications? Do we have to go back to the specialist? I mean, so many.
Can they do that? Can they have their
The answer
primary?
is yes.
They
Yes.
can.
Yes.
Okay.
So you can see your primary once a year for your annual Medicare wellness. You can see them every 6 months, however you had seen them in the past, and we can still continue services right along with them. So if I draw blood work that they hadn't gotten in 6 months or a year, I give a copy to the patient takes it to their primary care provider, and we share information back and forth.
That's beautiful. That's
Okay.
beautiful. That's good to know. So I want to talk about something just real quickly. We're going to go into detail when I have another guest in the future.
Sure.
But many people out there I've gotten this question on a community group that I'm on through Nextdoor, and the question was about VA benefits and the fact of how attendant care is so important. And so we're going to go into more detail like that. But if you're a listener out there and you have a father or mother that's either a veteran or a spouse of a veteran, please just know that you can have some help when it comes to veteran benefits, and that you may qualify up to over $2,000 a month towards your care.
And we work very closely with the VA system
you?
as well. I
Okay.
have 4 or 5 gentlemen that I work with that they provide all their medication for them.
Okay.
Everything. So all I have to do is submit everything into the VA. I fax everything over, and they take care of their
Great.
medications. So I let them do all the work. We share the information. I am just in there once a month.
That is so great to
regardless.
hear.
So
Okay.
that I think is another good thing that we offer is we see them monthly regardless of the situation.
That is so exciting. So tell me a little bit about just your role as the nurse practitioner and what you do and your coverage, like the coverage area. I know that if it's my understanding that Home MD is throughout the entire state of Michigan.
Yes. And
Is
we're
it
growing. We're growing even
awesome?
further.
That's so great to hear.
We're growing further
exciting.
north.
Northern,
So,
okay.
yes.
Great.
So we have the east side, the west side, the south side, a little bit into Ohio, and then we're going to be branching up. I think we're in Grand Rapids and soon to be Traverse City area.
Traverse City, okay.
So
That's
our
beautiful.
coverage is quite large. So it's all seen by nurse practitioners.
Okay.
And we order all the medications, we order all the diagnostic testings, we go through everything with them and their family every month, every time we make a visit.
Okay.
Okay. So if they
Great.
can't get out to see their cardiologist, or they can't get out to see their primary care, or they can't get out to see their specialist, we're able to kind of step in and fill the gap. And I think that's where the biggest problem has been lately, and especially with the COVID, is access to care. So I'm sick, I'm not feeling well, my doctor can't see me, it's going to take me 4 weeks to get in to see this one, it's going to take me 6 weeks in to see this one. If you call our office, or the loved one calls our office and say, hey, can you come out? A couple days, we can turn around and get somebody out there to help.
I know
immediately.
that I got a phone call from your office today about a patient, and we have a nurse going out tomorrow to see them. So that's how we roll.
That's how we do. And I think it's very important
great to
either
know.
way. You had reached out to me to see a patient, and I actually saw him the same day.
The same day. That was an amazing experience for someone that was overwhelmed. And this is what happens so often. We get someone that is so overwhelmed with what's going on. They're overwhelmed with and in this particular case, it was a daughter-in-law that was taking care of her father-in-law, and she was doing such an amazing job. But sometimes with dementia and other things that come about, it's not very easy. And then you have other things other factors such as stroke or things like that might happen that tends to be a little bit more
than what anybody anticipates.
Difficult. So I want to take just a quick moment, and I want to give a telephone number for anyone listening to the podcast that wants to get in contact with us. Telephone number, and someone will answer, is 586-580-7746. You can give me a call at that number. And again, the number is 586-580-7746. So if you need to get in touch with Michelle, we'll make sure that they get that number and get the referral over there.
Absolutely.
And they can also check you out on their website. Do you have the website information by chance?
Do I have the website information?
I believe it is. Let's see. It's www.homemdhealth.com. So there we go. So as we, what would you say is some of the biggest challenges that people are seeing right now with COVID at home and with the services, and that lack of communication maybe with family or not knowing what's going on?
And
what are you
hit
seeing?
it right on the head. It's lack of. It's either lack of support, lack of family, lack of time, somebody being there, lack of access, lack of, I'm not sure what to do. I haven't been over there. They won't let us in, depending on what facilities people are at. They have closed things down, locked things down, depending on, their own insecurities with letting people in their home, such as home care, physical therapy, lab work, the doctors, whoever it is coming into their home, they get very stressed about that situation too. Yeah. So I think it's been just a lot of access of care, not only coming into their home, but even trying to get out. So I think that's where we're trying to bridge that gap too, is that we are available. Sometimes that's the only people that they do see is their healthcare providers, and they appreciate that.
Absolutely. I actually had, and we'll address this on another show. I just got thinking of it I have a small group on Nextdoor that follows me. It's a resource group that I do for seniors, and I had a question that came about. There was a young lady that it was a woman that needed some services, and I was able to connect her to a free company that would go out and help her with some of those small household repairs that she couldn't do herself. So the resources that you and I have
together
are vast. That we have are great. There is resources through several different companies that are out here. I know that I met one of your owners through a health fair, because that's something that's going to be coming up for 2022. We're going to have Health and Wellness Connects health fairs coming out there. So I would ask the listeners to just be on alert. We'll announce those as they come along. Each week we're going to have a new show that comes to you, and we're going to see what happens. And I know you're going to be back on the show with me.
Absolutely.
I think it
is nice to have that network, because like you said, some people are very, very needy medically, and we can handle that. Sometimes it's the other pieces that we need you to network and help them navigate through. Absolutely.
And that's what it is. And for anybody listening, I don't charge for any of these services. If you have a phone call, if you have a question, if you have something that you need to have addressed, you can always email me at stressfreelifetalk@gmail.com. That's stressfreelifetalk@gmail.com. That's the original radio show that we had a couple years ago. So nice. We're back, and we're excited to really focus upon our seniors. I have to say that I've got an amazing grandpa who is 93 years old. And, Grandpa, you're the reason that I'm doing this. That and my grandma that has passed really just knowing that he gets the resources that he needs.
100%.
The families don't realize that we'll talk in the future about respite care and what that is, because there's so many people that have been caring for loved ones for a really long time and they don't know what they don't know. I mean, there's so many resources.
There's so many great resources that
there are.
if they just had a couple
So-
little leads here and there, it would make things easier on all of them,
Absolutely.
because the family is the unit.
Absolutely. So I am so excited to bring you this show. Happy New Year to you.
Happy New Year to you. Thank you.
And to all of our guests listening, Happy New Year. Let's make 2022 an amazing year. And let's educate ourselves and find out what resources are out there.
Absolutely.
Again, our telephone number is 586-580-7746. Thank you and have a wonderful, wonderful day.
Thank you.